Hi everyone, welcome to Medical Microbiology. Today we will continue chapter 13. This is lecture 2. We will discuss about the clinical stages of infection. First of all, we have to understand that there are three main sequences of infection. The first is finding the local or the portal of entry. So finding the portal of entry. So in this stage, the microbes, especially the pathogenic uh, microorganisms, will try to find the organs or maybe the tissue where they will be able to enter into the sterile tissue of the host. Usually the portal of entry are the skin, respiratory tract organs, GI tract organs, urogenital tract organs, and sometimes there are also placental entry. After finding the portal of entry, then the microbes will start to attach. Okay, so the second sequence will be attachment. Just remember, most viruses, usually the one that have envelope, they will use spike for attachment. Uh, Bacteria, they usually use fimbriae for attachment. Some of them maybe use the slime layer or glycocalyx, okay, for attachment. Some protozoa, they usually use flagella and cilia for attachment. For worms, they have special structure to attach, which is hooks or maybe suckers or maybe barbs. So these are the attachment structure of microbes. The third, after they attach to the organs, to the host tissue, then they start the invasion. Okay, so the invasion, they usually produce what we call the virulent factors. These are usually enzyme and toxin that will break the host tissue, and also they will destroy the host cell, and then the bacteria or viruses will be entering into the sterile tissue and then reproduce in this host tissue. So these are the common sequence, okay, which is the three main sequence of infection. We start with the stage number one, which is finding the portal of entry. Now, there are two main type of microorganisms that can cause disease. The first one is called the exogenous agents, which is this is the microbes that originated from outside the body. So this is not part of human normal flora. It is not part of the human indigenous flora. So it is mostly coming from outside, like for example, flu. Okay, flu viruses is not part of our indigenous flora. So it is actually coming from outside and then enter into the cell tissue and then cause disease. The second one is called the endogenous agent. This is actually the normal flora that already exists on our body, maybe on the skin. Okay, so whenever they enter into the sterile tissue, then they can cause disease. So this endogenous agent is actually part of our normal flora that enter into sterile tissue and cause disease. Now the main portal of entry are, of course, the skin. So these actually organs that face directly to the environment, like the skin. So the skin is actually the biggest organs of human body, and this is the place where many microbes will be able to attach and also enter into the host cell, the sterile tissue. The second portal of entry will be gastrointestinal tracts, like the mouth, okay, esophagus, stomach, okay, intestine, rectum, anus. These are organs that face directly into the environment. Maybe the intestine inside our body, but it is actually also facing the environment, which is the food and the drink that enter into the GI tract. So this food and drink actually coming from outside, and they also carry some microorganism and then enter into our GI tract. The next ones, okay, will be the respiratory tract. This is especially the okay, upper respiratory tract, like the nose and uh, firing. Okay, this is the most part of the respiratory tract that become the portal of entry of some microorganism. The lower respiratory tract, they are usually sterile organs, like for example, lungs, the alveoli, they all have to be sterile. Okay? So only the upper respiratory tract is considered as the portal of entry for microorganisms. The next one will be the urogenital tract. Okay? This is mostly the lower part of the urogenital tract, like for example the urethra, the vagina. This is part of the entry for microorganism. The upper urogenital tract, which is inside our body, like for example the uterus, cervix, ovary, testicles, bladder, kidney, they are all sterile tissue. There should be no microorganism in this sterile tissue. So only lower urogenital tract, like the urethra, the vagina, will be the portal of entry for microorganisms. Some other organisms, like for example toxoplasma, they able to use the placenta as the portal of entry from mother to the embryo inside the mother womb. So these are the portal of entry for microorganism. This is just some information about the most common type of microbes that use the portal of entry, especially the urogenital tract. Okay? And these are considered as the STI or STD, sexual transmitted infection or sexual transmitted disease. The most common one is actually human uh, papilloma viruses, HPV. Okay? So about 14 million cases per year, okay? Just in the United States. So 14 million cases of HPV infection through the urogenital tract. And just for your information, the HPV can cause or can initiate the cervical cancer, especially for women. That's the reason why there is a vaccine. If you are older, like maybe 18, 19, you actually have to take the HPV vaccine, okay, to uh, try to prevent against the disease and also prevent against the cancer. The second one is trichomoniasis. It's about 2,230,000 cases per year. Chlamydia, about 1,360,000. Uh, HIV, for example, is about 35,000 new infection per year just in the United States. So you can check this list, you can read this list for your information. Okay, the one that use placenta, they usually have abbreviation of storch, STORCH. S is for syphilis. So this is one of the disease. This is actually caused by bacteria that can be transferred to the embryo from the mother. Toxoplasmosis. This is also a disease that can be transferred through the placenta. O is for other disease like hepatitis B, AIDS, and chlamydia. So these are the diseases that can be transferred through the placenta. And then R is for rubella. C is for the cytomegalovirus. And H is for the herpes simplex viruses, especially the SHV number 2, the genital herpes. So these are the diseases that usually transfer through the placenta. Now, when we talk about the infection, then we have to know the ID, which is the infectious dose of the pathogenic microorganism. So the ID is actually the minimum number. So this is the lowest number of virus or maybe bacterial cell that can start the infection. So therefore, the lower the ID, then the greater the virulent factors, and also the greater is the uh, it's called a contagious disease. Okay, so the smaller the ID, the more contagious the disease gonna be or the pathogens gonna be. So look at this table. Okay, so measles, this is a virus. Only one virus actually can start the infection, and it is use the respiratory tract as the portal of entry. So this measles is considered as the most contagious disease. Okay, because one virus able to start the infection. Another one that is also very contagious is shigellosis. Okay, 1 to 10 cell through the ingestion can start the infection. Okay, compare, for example, with the cholera over here. So cholera, it require about 100 million cell to start the infection. Okay, so if we compare with the measles and cholera, then measles is very, very, very contagious, easy to be transferred, and easy to start the infection. Compared to the cholera, it's require at least 100 million cells to start the infection. So the lower the ID, the easier of these pathogenic microbes to start the infection, and usually they are more contagious. Okay, now the second stage, which is the attachment or the addition. Again, this is where when the microbes start to attach, find the right cell to attach, and then after attachment, they will start to do the infection. So just remember again, virus, they usually use spike for attachment. Bacteria, they use fimbriae, okay, and also glycocalyx, okay, for attachment. Uh, Protozoa, they use flagella, cilia for attachment. Worms, they have special structure like suckers, hooks, and barbs to attach to the host tissue. Okay, so these are examples of uh, microbes and their attachment structure and where that structure attached. So the target cell for that attachment. For example, the Neisseria gonorrhoeae, which is this is a bacteria that can cause disease called the gonorrhea. They have pili. Okay, so pili for attachment, usually on the genital epithelial cell, so in the genital area, urogenital tract. E. coli, and the name should tell you that this bacteria will attach to the colon or large intestine. It can cause diarrhea. And then what they use? They use fimbriae to attach to the intestinal cell, especially to the large intestinal cells. Shigella and Salmonella, they can cause disease called the gastroenteritis. They use fimbriae for attachment into the intestinal epithelium, especially the small intestine. Treponema, this is another bacteria that can cause disease called the syphilis. They have hook. Okay, so this treponema have hook that attach to the host cell. Usually they use the urogenital tract organ as the portal of entry. Trypanosoma, this is protozoa. Okay, so this is a type of protozoa. They can cause disease called the trypanosomiasis. And what they use flagella or flagellum to enter into the host cell. Many trypanosoma actually red enter into red blood cell and destroy the red blood cell. So mostly they can cause anemia because they perform the distractions of red blood cell. So they use flagella to enter into this red blood cell. Okay, the next stage, which is invasion. Again, they use what we call the virulent factor. Okay, so the virulent factors, usually enzymes and toxin. Now, what's the difference between enzymes and toxin? So this enzyme, they usually destroy the area between the cell. The area is called the interstitial cell. They break the junction between the cell, and then when this junction between the cells is broken, then this bacteria will be able to enter into the sterile tissue. So the way the enzymes produce usually is produced in the interstitial uh, fluid or area, and then they break the junction between the cell. Like for example, if this one a skin cell, they break the junction between the skin cell, and then when it is broken, bacteria will enter into the sterile tissue. Okay, that's the enzyme. The toxin, okay, they're also produced by bacteria, but they actually enter into the cell. So the cell is become infected, and then usually it will be destroyed. So the toxin mostly will destroy the infected cell, while the enzyme usually break the joint or the junction between cells. There is another virulent factors that some bacteria have, not all bacteria. Okay? It is called a capsule. So bacteria that have capsule, like this bacteria, for example, they're able to protect themselves against phagocyte. So phagocyte is a type of white blood cell that fight infection. So you can imagine if this white blood cell unable to kill the bacteria that have capsule, then this bacteria will be able to stay in the tissue, will be enter into the sterile tissue, and will be able to reproduce in the sterile tissue. So these are some example of virulent factors of microorganisms that they use for invasion. The next one, okay, some bacteria, for example, Salmonella, they produce special proteins that actually break the intestinal cell. So whenever this intestinal cell is broken, then this Salmonella will be able to enter into the cell and stay inside the intestinal cell. And then inside the intestinal cell, they start to reproduce. They will also destroy this intestinal cell, then usually causing bleeding. So Salmonella usually causing diarrhea that accompany with bleeding. Okay, so this is example of uh, infection factors or virulent factors of some bacteria, microorganisms. Okay, now we're gonna talk a little bit about toxin. So this toxin again is produced by some microorganism, and even it's also some of them is produced by uh, macroorganism. Yeah, like for example, snake they produce the toxin like poison. Okay, even plant they also produce toxin. So the one that we focus is the toxin that produced by microorganism like bacteria. eh, They produce also toxin that able to destroy the host cell. The adverse effect of the toxin is called toxinosis. So this is the adverse effect of toxin. Toxemias, when the toxin actually spread from one organ to another organ through the blood circulation. So this is what we call the toxemia. And then intoxication, this is especially when it is entered through the ingestion. Like for example, people eat uh, food that is actually contaminated with poison or toxin, then it is we call as the intoxication. So just remember intoxication related to food or uh, beverages or drink consumption. Okay, there are two types of bacterial toxin. The first one is called the endotoxin. So endotoxin is actually produced by bacteria that destroyed. So, like for example, white blood cell destroy this bacteria. Boom. When this bacteria is destroyed, they will release the endotoxin. Okay, so basically, endotoxin is produced by dead bacteria. Okay, and the exotoxin, it is produced by living bacteria. So these living bacteria able to produce the endotoxin, exotoxin. So this is living bacteria. Okay, so the endotoxin eh, is produced only by gram negative bacteria. So only gram negative bacteria have the ability to produce the endotoxin when they are destroyed. Right? The exotoxin is produced by both gram negative and gram positive bacteria. Okay, so exotoxin produced by both gram positive and negative bacteria, and they are produced by live cell. Okay, so we compare between exotoxin and endotoxin. So this one is actually exotoxin over here. Okay, so again, it's produced by living bacteria. Okay, so it's produced this exotoxin, and usually they will destroy the cells, the host cell, especially the heart, muscle cell, blood cell, intestinal tract cells. So these are the exotoxin produced by living bacteria and destroy some of the host cell. Now the endotoxin, this is the endotoxin. Just remember again, it is produced by dead. This is dead bacteria. So when the bacteria are destroyed, then they can release the endotoxin. Usually the effects are causing the what we call the physiological effects like fever, malaise, itches, and shock. So compare with the exotoxin, they usually damage the organ directly. And again, the exotoxin, they are produced by living cell, okay, of gram positive and gram negative bacteria. Okay, so this is exotoxin. Now the endotoxin eh, is produced by dead cell of gram negative bacteria. Okay, so these are the difference between an exotoxin and endotoxin. Again, you can read the list of these, the table of the different differences between exotoxin and endotoxin. So toxicity, so the exotoxin actually very toxic in small amount. Okay, while the endotoxin it requires higher dose or higher concentration. The effects on the body, just remember they usually destroy the cell for the exotoxin, blood, liver, nerve, skin cell. The endotoxin usually causing the systemic and less specific symptom, like for example, fever, inflammation, weakness, shock is a very general symptom. And then the chemical composition for the exotoxin is small proteins, while this one is actually lipopolysaccharide of the cell wall. And just remember, this lipopolysaccharide is only present uh, on the cell wall of gram-negative bacteria. So therefore, it's only produced by the gram-negative bacteria. The exotoxin usually unstable, and the toxin is very stable against heat. Toxoid formation, yes. So exotoxin can be converted into toxoid. So toxoid is actually a weak type of toxin that can be used as vaccine. Okay, so vaccine can be also made of toxin. It's called the toxoid. The endotoxin, it cannot be converted into toxoid. Fever stimulation usually not for the exotoxin, yes, for the endotoxin. Manner of release, again, this exotoxin produced by live cell, while the endotoxin is produced by cell that is destroyed. Lyse mean destroy or cut. So endotoxin is only produced by dead bacteria, gram-negative bacteria. And the typical source, again, for the exotoxin produced by the gram-positive and also gram-negative bacteria. Endotoxin is only produced by the gram-negative bacteria. Example of disease that caused by exotoxin are tetanus, diphtheria, cholera, and anthrax. These are some examples of disease caused by the exotoxin. For the endotoxin, examples are meningitis, endotoxic shock, and salmonellosis. This is the one that caused by the endotoxin. Now we're gonna go to the process of infection, or it is called the clinical stage. Okay, so clinical stage of infection. There are four of them. The first one is called the incubation period. This is the time, okay, from initial contact, okay, to the appearance of the first symptom. So this is what we call the incubation period. Different organism will have different incubation period. Like for example, COVID-19, maybe the incubation period is between 2 to 5 days. Okay, but for the HIV or AIDS, the incubation period can be 2 until 15 years. So you can imagine that so much different. Eh? So usually during the incubation period, eh, there will be no sign, no symptom. Okay, it means that the patients actually carry or have the disease, but he does not realize it because there is no sign and there is no symptom of the disease. That's during the incubation period. And they still be able to transfer to other people. Okay? So sometimes it is very dangerous because they don't feel the sign and symptom, but they're able to transfer this pathogenic organism to others. Okay. The second stage will be the prodromal stage. Usually, okay, this is the start of symptom and sign, but the symptom is very non-specific. Okay, it is what we call the general symptom. Okay, such as fever, weakness. Okay, so feeling discomfort, for example, this is very general symptom. We don't really know what caused this general symptom, general discomfort. Okay, so therefore, this is the stage is called the prodromal stage. After the prodromal stage, then there will be period of infection. This is the time when the organism is actually multiplies in the high level. So they multiply so much, and then it will give the specific sign and symptom for that specific disease. So we will know what type of disease is this because it has very specific sign and symptom. Okay, it's not only headache or maybe fever, but there will be more specific symptom of this disease. This is what we call the period of infection. And then after that, if our immune system, the white blood cell, the antibodies able to fight against this disease, then we will have what we call the convalescent period. This is actually the period of recovery. So we feel better. Eh, But we actually still have microbes in our body and we still be able to transfer to others. So this is another uh, stages that sometimes is noticeable, but it can transfer the disease from uh, one person to another person, just like the incubation over here. So the incubation, there is no sign, no symptom, but the patient still be able to transfer to others. And the recovery period, maybe the patient feel better, and the things is okay, but he actually still be able to transfer to others. Okay, so it is in the uh, picture. So this is the picture of stages of clinical infection. Again, start with the incubation period. And again, this is depend on the pathogenic organism. For flu, COVID-19, for example, usually the incubation period is between 2 to 5 days. Okay, but for uh, HIV, okay, maybe 2 to 15 years. So the incubation periods are longer for HIV. Okay, let's say we're gonna put this COVID-19 over here, and this is for HIV. Okay, now the again during the incubation period there is no sign, no symptom. So usually no sign or symptom. Okay, the next one is prodromal stage. This will be general symptom. Okay, so over here, general symptom. Okay. Maybe for COVID-19 is around 2 to 5 days. Okay. For the HIV, maybe several years. I mean, several maybe days or months. Okay. And then the next stage will be the period of infection, and this is when the bacteria or viruses reproduce in high number. So there will be specific sign and symptom. uh, So for the HIV, usually take about 7 to 10 days. Okay, this is when our immune system, the antibodies, the white blood cell fight the infection, and we feel that, and we have the sign and symptoms for that disease. Okay. For HIV, maybe it takes years. Okay. So this during this infection period. Okay. And then after that, if our body able to protect us again or fight against this disease, then will be recovery. So the symptom and the signs will be reduced. Okay, so the disease is actually gone. So it's a recovery period for the COVID-19, maybe about 5 to 7 days. Okay, so total the whole things, okay, from the incubation period until the convalescent period, usually for COVID-19 is about 10 until 21 days. So this is the time when, if you have COVID-19, you have to stay away for hours, but at least, okay, minimum 10 until 21 days. Okay, so these are the clinical stages of infection. Okay. I think we're done. We will see again on the next lecture. We will talk about pattern of